Hi, I'm Mike Lemons with ProCare Pain Solutions. ProCare is a comprehensive management company supporting pain management practices. We are made up of over 290 professionals supporting over 80 providers in 5 states. The scope of expertise we provide includes revenue cycle management, strategic planning and governance, business development and marketing, finance and accounting, human resources and IT, and complete facilities management. Come check out our ProCare team and find out what we're doing for our Napa facilities.
I think that the biggest thing here at ProCare is that we're dedicated to operational excellence. We've tried to take a lot of the functions that would normally happen in a physician office, which causes them to have maybe higher staffing levels, and bring that here to a central location. We've taken things here into our office, such as scheduling, accepting phone calls from new patients to schedule their appointments, authorizing things, all the way through the revenue cycle function, such as entering charges and billing dates of service out to insurance companies. Of course, the other piece of that is working appeals and making sure that the physician groups are paid for all the services that they provide. We've also taken other aspects of the office operations and brought them in-house, things like document management. The basic premise is to allow people in the clinic using clinic space to basically generate revenue there, see patients, and make their life easier. So when the physician comes in, they know that they can see a patient and exactly what they can do to them and be assured that they're going to get paid for that service. In the scheduling department, we've created a centralized call center, which actually frees up staff in the clinics from having to answer the ringing phone for all of the new patient visits that are coming in. They take basic demographic information and can typically do that more accurately than in the clinic because they're not faced with patients at a desk also. They're not multitasking. Their main job is to enter demographics and schedule appointments appropriately based on physician preferences and templates. They utilize clinical documentation in conjunction with the payer's policies for specific procedures. They submit documentation when necessary to get a procedure authorized. There's a lot of nuances to doing this because with pain procedures now, there are frequency limitations and there's specific clinical measurables that must be obtained in order to get authorization for continued treatment. The centralized triage department here at ProCare helps support the practices from a distance. We've centralized that so we can have fewer staff who field phone calls for multiple practices. We're also able to more easily separate things such as medication, prior authorizations, or post-procedure questions by having it centralized. The revenue cycle team here consists of 3 different departments. We have the charge entry team who analyzes what the physician has entered into the EMR, reviews documentation, applies appropriate modifiers to make sure that we are meeting all the payer rules and regulations, and they submit the claims to the insurance company. Later in the process, we have the accounts receivable team. They process all incoming payments, they work appeals, and also work with insurance carriers with regard to any issues that we may have with payer policies and rules and claims paying correctly. The third piece of that is our patient collections department. In that department, we proactively call patients who have balances, try and set them up on payment plans prior to them even coming into the clinic. We can also accept payments before they get to the clinic to avoid some of the awkward front desk discussions or the delays in processing a patient when they get there. Although we've tried to centralize as many things as we possibly can here at the corporate office for ProCare, there are some things that can only be done in the clinic. On-site clinic management is one of those. Dependent on the size of the practice, the number of locations and providers, we have either charge nurses or practice administrators there. Those local on-site leaders are most often clinical, so they are a working part of the clinical team providing patient care as well as overseeing the administrative and management functions.
In addition to revenue cycle management, we also do a variety of other administrative tasks for our pain practices. So we do accounting and finance, we also do human resources, we do facilities, we do purchasing. So for accounting, for example, we do financial statements for our Michigan pain practices. We'll do financial statements, we do banking relationships, loan management, that sort of stuff. Human resources, we do actually have about 300, just a little under 300 staff members here in Michigan under ProCare. About 85 are in this administrative building. Those are billers, schedulers, other administrative employees. We have about just over 200 clinic staff that work with our physicians, so registered nurses, medical assistants, rad techs who work with the physicians in the sites that they're at. So we do employee screening, ads, we're doing handbooks, we're doing benefit administration, disciplinary actions, all the typical HR items that one does with employees. We do those for our physician practices in Michigan. So we also support facilities and purchasing for our clinic sites. We do lease negotiation, we do vendor relationships for maintenance and housekeeping. We also do purchasing for our sites for clinical supplies and pharmacy items. So we set formularies, we help negotiate vendor pricing, those sorts of things. So we do a lot for our physicians, both in the facility and the purchasing realm.
Business development really is comprised of 4 different components. There's marketing communications, there's referral development and referral relations, recruiting, and then also new business. The mantra that we've always followed in business development is marketing is operations and operations is marketing. We are in the service business, and it comes down to how well we treat our patients, how well we treat our referring physicians, and how well we treat our community. We use a framework or a guideline for how we do what we do, and that framework is called SAVE. It's an acronym for Solutions, Access, Value, and Education. So everything we do, we work within those guidelines of how do we provide solutions to our customers and clients, how do we provide access or eliminate barriers for them, how do we provide value, and then again, how do we do that in an educational way so that they feel like what we're providing them is what they need. And we do that in everything that we do when it comes to marketing, referral development, and recruiting and evaluating new business. When it comes to basically working with the individual pain practices, we begin by evaluating their data. We look at the provider's productivity reports, which gives us a high level of information, such as patient volume numbers, new patients per provider, number of referring physicians for each provider. We also run trending reports that show us who's referring to each practice and when they refer. And that allows us to kind of determine when we do what we do in regards to marketing and communications. We also evaluate the demographics of each practice. After we evaluate the data, we formulate a strategy that helps us maintain our relations with the top referring physicians, as well as cultivate new relationships with referrals. We then basically quantify all that information and measure it and track it monthly and provide that information to our practices and our physicians within our practices. Tactics we use, how we specifically get this done is boots on the ground. We visit referring physician offices, we talk with them, we ask them what we can do better, we survey them. We also do quarterly mailings to all the physicians that refer to our practices. We do websites for all of our practices. Right now we're managing about 8 websites. We have social media campaigns. We have Facebook pages for all of our practices. We use our administrative team here also in the scheduling department to help us book lunches where we do lunch and learns with referring offices. We put together advertising campaigns for our pain practices, which consists of TV, radio, billboards, digital campaigns. We also create landing pages to help support those advertising campaigns so that way we can track the success that we're having. We do a lot of events for our practices where we put together maybe opioid presentations to primary care physicians. We do Arthritis Foundation events where we talk. So we probably do 2 or 3 of those per year per practice. How are we ultimately measured when it comes to marketing, communications, and referral development? We're basically measured on how full our provider's schedule is. So we watch their schedule. We're very diligent about it. We do what we can to make sure that they have a full schedule.
I'm Chris, IT Director at ProCare. We've got a staff of 5 IT people, and we're much more than just IT help desk. Our primary role is to keep physicians working as efficiently and productively as possible. And part of that is through tweaking Centricity. Centricity is the electronic medical record that our doctors use, and it's highly customizable. So we've got programmers who can tweak and program the system to work exactly how the doctors need it for their particular workflow. Of course, for physician productivity, it's important to have efficient and productive clinical staff. So we work closely with nurses, MAs, and clinical admin staff to improve their workflows, and we will do business process improvement projects and again tweak the system to keep them working efficiently. So we end up taking a lot of calls and support tickets from doctors directly and nurses, and we're able to resolve their issues as they come up and keep them working as efficiently as possible.
As a healthcare provider and a pain physician at Michigan Pain Consultants for the last 4.5 years, ProCare has allowed me to do my job. In the changing industry with health insurances requiring prior authorizations and wanting to know why we do what we do for our patients, ProCare has made it easy for me to do what I need to do, and they do what they need to do in the back end to make sure that my patients get the care that they need.
I've always been more than willing to admit that I'm a doctor, I'm a physician, I'm not a businessman. I don't have training in business, I don't have training in human resources, I don't have training in management. Those things are simply not in my wheelhouse. What I can do is practice the specialty and subspecialty of pain management. If I can treat the patient and depend upon ProCare to handle everything else, my practice works, and we've done it this way for many years. I came in 2003. I came from another practice, a hospital-based pain practice, and the difference between ProCare's management and what I experienced in that hospital practice is day and night.
Thank you for taking time to learn more about ProCare and the services that we provide. Stay tuned as we expand our footprint throughout the Napa system. I look forward to seeing you in Melville. Take care.